Again, there, people are saying. All right. Awesome. So, welcome everybody to the Clinic of Jones Physical Therapy. I am Dr. Liz Jones. Um, First of all, I'm a mother of four, a wife, and also a physical therapist. Doctor of Physical Therapy. Started this clinic in 2007. And over time, just work and where things brought me and where my path has brought me, I work mostly with women's health, meaning the pelvic floor, dealing with issues from incontinence to pelvic pain, kind of a really broad spectrum of things. And in working with that, finding this common theme in women, and it's a little bit harsh to say this attack on women, but there's this common sense of anxiety, of grief, of feeling like you're worn out that I was seeing in women over and over and over again. And when I first was trained, it was a lot about the science, the contract, relax, the muscles, the strength. But I started just realizing more and more in my practice, there's more to this. There's emotion, there's a lot more tied into it. And truly coming into my own confidence of who I am, of who I was created to be, and how God wanted to work through that. So this talk, we will, it is a faith-based talk. It's also about human beings in general, because we can't really separate our mind, body, and spirit. Society tends to want to, and a lot of times in medicine, I think we try to separate them, and it doesn't always work so well. So what this talk is geared towards mothers and their young daughters. So anywhere from 13 to 20 is kind of what I had said. There's going to be a lot of topics that we cover. There's some things you may say, wait, I want to know more about that. Please take notes. You guys have little booklets with you. Please take notes if there's anything you want to know more about, something that caught your attention, but I maybe didn't go into it. I'm trying to keep it a little bit concise, and also knowing that I'm really speaking a lot to your daughters in this. So for instance, one example that's very clear is intimacy. So there's a lot of grief I see with women, and a lot of difficulties. It's an area a lot of women struggle with. So it's not something I'm going to go into detail in this talk, but that is an example of something that really still affects a woman and the gift of being a woman that we just won't speak as much to here. So again, any issues like that I touch on that you want to know more, by all means, write it down. So this talk, the gift of being a woman. I was told by a dear friend to try to keep it, what are your 3 main points? And I'm like, well, I have so many points. But the 3 points I want you all to walk away with this is how beautifully, intricately, and intelligently you are created. The second one is that you have this amazing tool within you to help you through a lot of things. Use it. The third one is that you are loved. So those are the kind of the main points I want you walking away from this talk with. Okay, so what is being a woman? We say the gift of being a woman. What does that mean? So first thing we're going to talk is anatomy, physiology. What is a woman? What is female? That sounds kind of silly, but it's amazing how many grown women come into my office and don't know that they have 3 holes down there. So you're getting an anatomy lesson. This is the science geek coming out in me. So I'm going to talk mostly from the pelvic bowl because, again, as a physical therapist, that's a lot of where I'm working is on the muscles and what goes on down there. And you're going to see how these muscles actually build into a lot of different things in the function of your body. So for those of you virtual, the very first picture you have is the more superficial layer. So I'll kind of guide the virtual people through this with the pictures they have, because you're not going to probably see the model as well. So here's that pelvis, okay? The part up here, the pokey bones of the hips up there that you see. Back here, we have tailbone. These bones right here are the sit bones, like the bony part of your butt when you sit down. So they actually sit pretty far forward compared to what we think. So what we're going to talk about more than anything today is the pelvic floor. So on the outside, you have vaginal rectal opening. The 3 holes you have are urethra, because bladder sits here, urethra there. So the urethra here where urine comes out, vaginal opening, rectal opening. So for those of you online, you've got that superficial picture that shows these muscles on the outside. Take this away. Here we have the deep pelvic bowl, the pelvic bowl muscles. So they literally sit and cradle inside the pelvis for you. Again, right here, they wrap around urethra to stop flow of urine. They also come and wrap right around that rectum to stop from passing gas. So that's why when we talk about a Kegel, it's stop from passing urine, stop flow of urine, stop from passing gas is a great cue. So these muscles have three physiologic functions. They are supportive. These muscles have to fire for your transverse ab to fire, which is like the corset around your body, the ab muscle that wraps around. So these muscles fire, and then those muscles fire and lock the SI joint, sacroiliac joint, together. So if you don't have that, that sacroiliac joint wants to kind of do this weird shearing on you. So especially in pregnancy, it's a really common time that that joint will get kind of caught where you stand up and you're like, oh, I can't move. Clicks, feels better. So stability, these muscles are the base of your foundation. So every time you go to step, move, if you feel like something's going to hit you and you brace, these muscles actually are supposed to fire first and then stabilize the spine. If these are not firing, your hip flexors, people hear about the psoas, tight hip flexors. If these muscles can't do their job, you have decreased endurance here. That means that hip flexor has to kick in to help you. So you get this weird tension pull here, and then the low back, the hamstrings. It kind of becomes this odd tension pattern all the way up your spine. So supportive, these muscles have to fire in order for your body to function, to move, to walk. And then sphincter, as we talked, bowel and bladder. So this is where incontinence, the little bit of leaking of urine. We actually see incontinence a lot in young women. Oh, I giggled so hard I peed, and they kind of laugh about it. But most girls really are very self-conscious about it. We actually see quite a few young women in here in their high school, junior high, that they're having this happen. Also coughing, sneezing, jumping, starting blocks in track, coming down from a jump in volleyball. It's actually, again, really common for our female athletes to have incontinence. And then, again, the bowel, the sphincter there. So we'll come back to that part with the jumping and all of that. But the other part, functionally, for these muscles is sexual. They contract, relax during intercourse. That brings good blood flow, oxygen, nutrients to the body, helps the sperm get where it needs to go for all of that good stuff. So we won't, as I said, dive into that as much today, but going back to the incontinence piece, what happens often with women is that we have that tension in holding, and especially if you're nervous about leaking, you tend to hold even more. So we tell our women in practice all the time, it's kind of like you're doing this all day long down there, and then when you say, hurry up, shrug your shoulders, your muscles have nowhere to go. So you kind of go, I think I did. That's what happens with that pelvic floor. So think about all day, if you're nervous about something, worried, and tensing a little bit, and you go to track practice and jump, well, those muscles just can't pinch off anymore, so you might get that leaking. That kind of leads right into that next piece of when we are sad, angry, scared, mad, frustrated, stressed, we don't go, oh, I'm really stressed out and I have a big test I totally forgot to study for. We kind of clench up those muscles and say, oh, okay. Unfortunately, it's a very common pattern that we get into in our day-to-day lives, and we end up staying there. Our muscles have memory, so they often go right back to what they know. So all of you, even right now, just think about it. Are you clenching your bowl or are you relaxed? I mean, it's amazing, even just in driving a car, it's like, why am I clenching up right now? There's nothing going on. No one's running into me, but we tend to do that. So we encourage women all the time, put a little sticky note on your computer with a smiley face. And every time you see it, just kind of catch yourself and go, okay, relax those muscles. Because when we stay in that tightened spasm mode, we can't get the oxygen, the nutrients to the tissue, and it becomes this ischemic tight muscle. So just like when you've got that rigid muscle up in your neck, if you're clenching all day, at the end of the day, when you come home and relax, it doesn't become a soft, supple muscle. It's kind of this wiry thing. That's what happens in our pelvic floor also. And over time and over years, that just gets into that mode of holding. So with our young women, and actually as you get older too, that's a big pattern that we have to try to shift in the body, is to not go into that tension right there, right away. With that being said, for you virtual online, the next picture of the body, it actually shows the cavity of the diaphragm and the muscle connections to the skeleton. So when we talk that tension stress pattern, not only is it fatiguing out your pelvic floor muscles, but it affects your body all the way up. So there's actually a direct link of tension between your jaw and your pelvic floor. So those of you who are jaw clenchers, if you notice you're getting tension here, guaranteed that pelvic floor was already firing. So what happens physiologically, we tend to hold there, say it's a stressor. You're worried about something, you're stressed about something. When you tense up there and to be able to breathe, your diaphragm sits in here. It needs to be able to come down so you can get air into your lungs. What tends to happen if that pelvic floor is rigid is there's nowhere for all your organs to go, so the diaphragm can't come down very far. This becomes a pattern where your diaphragm just doesn't move well, for one, but it doesn't have the ability to move. So what then happens is we use all these accessory muscles up here that are then made to actually lift our ribs and create more space for our lungs. So by clenching here, you're now creating this tension pattern up in here to breathe, and you're not breathing as efficiently. So you might feel fatigued, you might feel headachy by the end of the day because you're not breathing enough. Everyone laughs at the watches that tell them how to breathe and when to breathe, but it's a real thing. Most people don't breathe very well, and they don't breathe completely. So again, that's physiologically, there's a lot of connections there that happen with your body simply from a spasm pelvic floor, okay? And we go into this with women because most don't even realize they're doing this. They don't realize they have a tension pattern. And we'll go over this with them, and they get off the table and they go, wow, I feel really relaxed. I can breathe more deeply. And we encourage every hour of the day, check your bowl. Are you relaxed? Are you breathing? And they'll come back to their next visit and say, I am tense all the time. And they didn't even realize it before. And so it's interesting how we get into those patterns. And for you younger girls, you know, you might be thinking, I don't have this, I don't have that. But you guys have a lot of tensions throughout your day. It may not be work and dropping off kids. It may be, did I remember my assignment? You know, the social pressures, those types of things. You guys also have this tendency to hold and guard. The next one we're going to talk about is, well, actually for the breath, let's go back to that. I want everybody to right now just take a breath in and out and kind of feel what you feel in your body. And then what I want you to do is I want you to put your hands on the sides of your ribs, gently, or you can kind of do it this way, however it works for you. And when you inhale, I want you to picture breathing into your hands. So picture breathing into the sides of your ribs and feel how different that is. Okay, and now you don't have to hold your back, but think about the back of your ribs and breathe. And think about breathing into the back of your rib cage and how different that feels. We tend to breathe right here, and we think we're being good belly breathers right here. It's actually a whole cylinder, our rib cage, the muscles around there. So when we inhale, it's not just here, it's literally 3D. This whole entire cavity comes out like a cylinder and back in like a cylinder. Think about that gentle pumping motion. We have the lymphatic system and the digestive system. This is huge for both of those systems. Digestively, we see so many patients here with constipation, chronic constipation. They may have changed their diet. They're trying to drink more water. They're trying to do all these things. But again, if we're not getting that natural ebb and flow to our digestive tract all day, it's like a kinked hose trying to get things through. So we will get those restrictions in there. So that's, again, where that breath is important. And to start, we need that pelvic floor to be able to move to encourage that proper motion. Okay, menstruation. Everyone loves talking about menstruation. This is another gift of being a woman. And people look at me funny, like, how is that a gift? It actually is a beautiful gift that we have as women. It is something that when you think about it, don't think of the inconvenience of it. Think just about the anatomy, the physiology, and what happens in our body. No matter what we're doing, no matter how busy we are, how present we are, our body keeps this rhythm every month. It comes through and it says, okay, I'm going to build and build and build, and I'm going to create this welcoming, warm, amazing space in case this little fertilized egg comes. I have the place to grow it and take care of it. And then if that does not happen, it lets go of that. So every month we have this building, we have this growth, this fertility, and then it just lets go of that. And I tell women, because so many women come in and they do not have a very positive relationship with this part of their body. They don't have a very positive relationship with this cycle that their body is keeping for them. But to think about this, I always say we kind of have this great thing in our body. It helps us every month say, okay, whatever you need to let go of, let go of it. Don't hold on to it. Don't carry it on. And sometimes in my work, I would think, okay, maybe I'm going a little too far with the emotional connection. Not everything's emotional. But I had one patient who had some horribly heavy periods. So literally, she couldn't work just because of the flow, the heaviness of her flow. And she was in some really tough situations in her life. And we talked about it's almost like your body is trying to help you let go of something. It's like it's trying so hard to help you let go of something that's just holding on in there. She literally made a very healthy boundary with the very unhealthy relationship in her life. And the next month, her period was completely normal. So I'm not saying it's always that cut and dry, but there's a definite connection with our body and how it's always trying to balance for us. It's always trying to heal. It's always trying to keep us in the right space. I always laugh. I have 3 daughters and 1 son. Are we not working? Okay, I'm supposed to ignore him when he comes there. So I have 3 daughters and 1 son. And, you know, as mothers, you never quite get to go to the bathroom on your own or anything. So of course they ask questions about, you know, menstruation, and I always just say it's a bleeding time. And, oh, mom, you know, it's like, it's this beautiful way our body works. And I explained it that way. And one of my daughters, I'll never forget, she goes, I can't wait till I'm a mom and I can have a bleeding time. And I'm like, okay, it's not that great, you know, it's not like it's just glamorous. I'm like, it is a little inconvenient and it's not the most comfortable thing, but it really is a beautiful way our body is made. So to honor that, to not get angry and resentful with it, that again, it's a beautiful way that we are created. So along those lines though, and there is pain with menstruation. That's not abnormal, but really hard pain, pain you can't get through, pain that keeps you from going to school, from doing things, the headaches. That is not normal, okay? Again, our body is always constantly giving us signals. It's giving us, you know, you walk outside and it's hot, you think, okay, I need water. I mean, it's constantly giving us signals from our surroundings to keep us safe. When your body feels pain, that is not something to ignore. What we see here so often is, I would say, in the 30 to 40-year-old women or older, is that they maybe had extremely painful menstruation as a young girl. They were then taken to the doctor to say, okay, what's wrong? The doctor says, everything looks fine. So right there to that little girl, they're told you're fine, but she's feeling all this pain. So it can cause this really strange disconnect in the body of having a hard time listening to those signals. So this girl going, okay, I supposedly I'm normal, but this really hurts. Either I got to suck it up and deal with it, or they kind of look around at their friends who seem fine. So right there, that young girl's perception of pain in her own body is her 5 out of 10 pain is someone else's 10 out of 10. So she's already learning to dissociate from that and not quite listen to that signal because she can't stop her life every month. So don't ignore pain. Another unfortunate scenario is that a lot of women go in, or mothers take their daughters in, and one of the first options that's given is birth control for painful menstruation. In my opinion, both morally and from a health standpoint, I don't think it's a great option. I really don't. A lot of the menstrual pain, a lot of the cramping, the low back pain, those discomforts, it's from a surge of prostaglandins released in the body. So honestly, if we can do an anti-inflammatory 3 days before your period starts, a lot of those symptoms can actually be taken care of before they get to be too much. Now, if that is not helping, we look at diet. Is there a lot of inflammatory foods you're eating? Is there some really big hormonal imbalances? The first 1 to 3 years, a young woman's body is trying to figure out, what is my cycle? What am I doing here? So it's really important, I think, as mothers to be an advocate for your daughters in this regard. Go to a practitioner who you can have this honest conversation with. If birth control is the first option given, advocate for your daughter. Okay, I don't believe it's a great option to take a medication and to take something healthy and shut it down. We see many women who've been on birth control, easy 20, 25 years, because they went in as a 14-year-old. That's what the doctor said was the best option. And in the defense of the physicians, at one point, they did feel that was the best option. That was their training. But we know better now. So don't ever hesitate to question that choice. Don't ever hesitate to advocate for your daughter or find a practitioner who will look at it a different way. The other thing that comes with that, and I've heard this from practitioners, is often there are reasons given, such as painful menstruation, acne, because girls want to be sexually active. That's a very honest conversation that girls and mothers need to have, because we don't want girls getting put on birth control without assumption. And again, and we'll get to sexuality later, but that's a very unfair assumption for many young women. For many young women, that is not their motivation, but it's almost assumed from some physicians it is. So it's like, okay, here you go. No one questions it, so it carries on, okay? So again, mothers and daughters, have some honest conversations about that, what your intent is with that. There are actually many, many medical conditions that birth control is one of the first go-tos. And again, I honestly personally don't agree with that. A lot of our gut health, a lot of the inflammatory foods that we eat can really take care of a lot of the endocrine type issues, the endocrine balancing issues, the hormone issues. Ask to get your hormones tested. It's difficult to test because it's kind of a snapshot. We get that, but there are other levels and hormones in the body that can be checked, and other labs that can be done to at least see where you're at if there's something abnormal going on. That goes into another condition called endometriosis. So endometriosis is very, very common. It's unfortunately, how do you say it now? It's like it's underdiagnosed, but kind of over-exaggerated. I don't know how to say that any better, but it's not often caught until a woman gets older or is maybe having fertility issues, and they take a look and say, oh, you have endometriosis. Unfortunately, when that woman goes to a doctor and says, I have endometriosis, it's like, oh, you have endometriosis. Most women who deal with this condition actually know a lot more about it than their practitioners do. It is actually the lining of your uterus, so that part of the uterus that sheds, the inside lining that builds up, getting ready for that egg, getting ready for ovulation. It's when that lining, actually, that same tissue starts growing outside of the uterus. So during menstruation, it can be very, very painful because it can be in the cavity. It can be adhesed to the bowels. It can be adhesed up into the diaphragm. It can be incredibly painful. It is no small matter. Again, women who deal with this have such a skewed perception of pain, and they have such a severe disconnect from their body. And it's honestly so sad to see this, because their body is trying so hard, and they are so angry with their body because of the pain. So that is a very real condition. We will be posting resources. There's Nancy's Nook on Facebook. There's a book that Natalie recommends often called Beating Endo. It's really, it's a disease, it's a condition that it's really great to educate yourself on it, and even looking at those things to see if that might be something you're dealing with. Because again, it really affects a woman's psyche. It affects her body. It affects her life because of the pain. I often say to women with pelvic pain, you would get more empathy if you take two fingers together like you sprained your fingers. Women are tough. We are, we deal with a lot of things, and you can't walk around going, oh, my pelvis hurts all the time. So you just function. So you're having a bad day, and people are like, what's up with you? And it's, people don't realize the severity of it when you're really truly suffering with that pelvic pain. And again, it's not something to just suffer with. There's a lot of things out there. We're learning more and more every day, and there's more and more education and advocacy for it. In this community, we have some really great practitioners. So you can find some good ones around here, definitely. So don't settle for someone who you don't feel is listening to you, because you do know your body, and it's constantly giving you signals if it's not doing okay. Along that line, we do have a great network of practitioners in this town that are actually trained in the fertility care system. So it's, I think, traditionally known as natural family planning. It's not just for achieving or avoiding pregnancy. It is actually a great way, and I believe there's some practitioners that, I think most of them, will meet with young women too, young girls, so they can learn how to track their cycle and know their body, know what's going on, know that there's certain times of the month that, I have all this energy and I feel great, and there's certain times I'm kind of funky. To be able to track that is really great for your health, because you can catch a lot of conditions that may be going on. I do tell women a lot, it's great to be aware of your cycle, because it helps you to be a little more gentle with yourself. If you are coming up 2 days before your period, do not start a big project. You are going to feel like you're going up a hill with a 100-pound plow behind you. It's just not going to go well. it's a time to truly be gentle with yourself. That if you feel like, man, I am a bear, that might be that your progesterone is just tanking a lot way too quickly. So there's reasons for some of those reactions hormonally. We know that digestively things change right before your period. Hemorrhoids are more common to flare. In our young female athletes, there's actually studies that women are actually more likely, or young females, to blow out their ACL around that time of menstruation. So there's a lot of physiologic changes that happen with that cycle, not to be angry with or frustrated with, but to be gentle with yourself, that this is my body. I need to just slow down and be gentle right now, because honestly, in 2 weeks, you're going to feel like you can conquer the world. So just wait, it's coming. So listen to that, because it really is important. With the fertility care methods, again, there's quite a few practitioners in town, and there's actually quite a few methods. So whether you're a visual learner, what you're more comfortable with, what you think you'd be able to stick to. I do have pamphlets for that. It will also, for the virtual crowd, you'll get that in your resources, that we do have one gal here that'll kind of triage, you know, if someone comes in with a request, she'll kind of understand what you're looking for and be able to get you to a practitioner. So that is another great service to take advantage of in our community. I will also list, if you would like, resources, practitioners. We've got some great naturopaths in town who really look deeply into the endocrine system, into gut health. And also we've got some great medical practitioners who are on board with a more natural approach and willing to work with you on some of those things and listen to you. Okay, so that is kind of the nuts and bolts of who we are physiologically. So when you say you are a woman, what does that mean? And you can all kind of think about that. What does that mean to you when you say, I am a woman? What does that mean? There's a quote that I absolutely love. It's by Leon Bloy. I think I'm saying that right. It's, the holier a woman is, the more she is a woman. And I think that's such a beautiful statement. The word holy means to be set aside for something sacred, to be whole, to be uninjured. So the holier a woman is, the more she is a woman. Unfortunately, in our society, sometimes holy is used as holy roller, or you're so holy, holy. But especially as young women, you should strive to be holy, to know your own beauty, to know your strength, to know how beautifully and intricately and intelligently you are created. This ability a woman has to love is unlike anything else. You know, they say a mother's heart, a mother's touch. There's a beautiful strength in gentleness. There's this push sometimes to be strong and tough, and we're very strong. We can endure a lot of things, but truly our ability to love and our gentleness is one of our greatest strengths. Women are often referred to as a vessel, as a ship. Truly that selfless love out of wanting what's best for that person, that when they come to you, they leave a better person, that you want them to be stronger and to be healthier. So we have that, and we have this ability on an emotional standpoint, I think, to understand things a little deeper, and to feel things a little deeper. So when we think about that pelvic floor again, we kind of have the left side of our brain is more analytical, which goes to the right side of our body. The right side of our brain is more creative, that goes to the left side of our body, because things cross in the spinal cord. Anyway, so when I talk this with women, I often say the left side of your bowl, those pelvic muscles, is more that feminine, creativity, beauty, flow, nurturing, compassion, empathy, fertility. That right side usually emotionally represents more A plus B equals C, get things done, be productive. We tend to be very comfortable over here on this right side, because that's where we're praised. Good job, you were productive, you got good grades, you contributed, you're efficient. That's kind of where we get praised. We don't often get praised for, that's wonderful, you really listened to your heart on that one. You know, we just, honestly, it's sad that there's almost this negative connotation to being soft. It's like, I got to be strong, I got to be tough. I use the example a lot. Say you have a conversation with somebody and something a little bit harsh is said, and you're like, oh, whatever, I'm fine. It's like this right side says, I'm fine, I got it, I'm good. And the left side's going, I don't think she's fine. Like, I think that kind of hurts. So I'm going to sit here and hold it until she comes back and can say, oof, that was hard. And we do. We often are in situations where we do have to function. We have to carry on. But to always be able to come back to your body and kind of go, okay, wow, I am really tense today. What was going on today? What was I stressed about? Why am I holding and clenching so much today? And to be aware of that. Because remember, our body is always giving us signals of what's going on in our environment. And we are physical, emotional, spiritual beings. We can't separate them. If you're scared or worried, you clench up. If you don't feel good, if you're sick, you emotionally are drained. We're very connected. That's where you can't take one and leave the others. So with that pelvic floor, this is a space for you young women to realize, and for all of us, this is one of the places where I think we are the most deeply interconnected mind, body, and spirit. And it's really a beautiful thing because, again, we talk that function. It holds these vital organs. It actually keeps us upright so we can move. It protects us, functions of bowel and bladder. Emotionally, when we're stressed, when we're worried, we tense up there. And spiritually, there's some really beautiful, deep things that occur here. So it's a space in our body where we kind of talk more into that tool we have available for us. There is a sacredness to that space that I wish every woman would be able to acknowledge. There's so many women with hurt and grief, and they just don't even see how beautiful they are. So literally just holding that space. I encourage women all the time, just put your hands right here and just be. And it's amazing how sometimes it's like, oh, I'm fine. No, just be there. Honestly, be there and realize, wow, yeah, this part of my body, it keeps this rhythm, all these things that happen here. And at the core of my being, the goodness of how I was created, to just be there. It's interesting how often when I work on women, I do internal work on the pelvic floor, the left side of that bowl of those muscles, it's literally like this. I mean, it'll just be like a cement wall there. And it's interesting because it's almost like this blocking, this inability to receive. It's hard to receive love. It's hard to receive support. It's hard to feel worthy of being loved and being supported. And it's interesting because sometimes they can't even tell that I'm on their left side. And as we work on that awareness piece, it's really beautiful to see them kind of go, oh, I have this whole side over here. So again, there's this beautiful way that this space is created. And we'll kind of get into how we're going to use that later. So we talked about how our body's always giving us those signals and how we're interconnected throughout in a lot of different ways. So fear and anxiety, our sympathetic system revs up when we are worried, when we're scared. So I would use the example of a bear is chasing you. What does your body do? It goes in this adrenaline rush. Oh my gosh, gotta go, go, go. Unfortunately, in our society, our bodies think we always have bears chasing us because we get so anxious, we get worried, we get stressed, we have all these things going on. So our body is often reacting to this pattern of constant stress, even though we maybe don't have that big of things right there. So the beautiful thing of this pelvic floor, and we're going to do an exercise in the bit here of teaching you this, is that when we truly come into that space and relax, we can actually calm down that fight or flight sensation. We can calm down that sympathetic system that says, oh my gosh, something's going on. So we're going to actually do an exercise. And you online also, Natalie's going to cue it and explain or say your answers for me. But we're actually going to go around the room. Everyone is going to tell me their name, about what age you started menstruating, and something that makes you very anxious. Okay? Now, as you all think about that, I want you all to feel what your body is feeling right now. We are not doing that exercise, but every one of you would. So just even that, and I would never ask you guys to do that. And online, please don't start typing your ages of menstruation to Natalie. We don't need that. But I even asked them, is that really mean to do to people? But think about how your whole body went, oh my gosh, I don't want to say this. Just that little bit of stress anxiety. So how many little moments do we have in a day where our system fires up, where we get anxious, where we get worried, and how our body's reacting to that? And we have muscle memory. The Navy SEALs use this. Athletes use this. We practice over and over, and our body just knows where to go. Well, it works on this side too. If we're constantly going into that state of panic or that tension, pretty soon our body wakes up and it goes right into it. So we talked about the pelvic floor. So I want all of you guys, and those of you at home also, to picture that pelvis, picture that bowl of muscles that kind of nestles in there, okay? I want you to, everybody just close their eyes. I want you to think about relaxing your hips, your thighs, your butt cheeks. Let those inner thighs relax. Think about the back muscles relaxing. I want you to picture that bowl of muscles. Literally in your mind, walk around the left side of those muscles. If there's any tension, tightness, think about relaxing it. Walk around the right side of that bowl. Same thing. If you feel any areas of tension, tightness, try to breathe into them. So as you inhale, think about that oxygen going right to that area of tension or the entire bowl. When you exhale, think about releasing that tension. Also, you can picture those sit bones that you're sitting on. Picture them gently spreading apart from each other. That's going to help you let down those muscles just a little bit more deeply. And just think about those muscles relaxing. Think about the blood flow, the oxygen coming to them. Let your neck and shoulders down. As you inhale, those pelvic muscles will gently relax a little bit more to allow space for your organs. As you exhale, they gently come back. So think how differently your body feels even just right now than it did when you thought you had to tell me when you started menstruating. So that's just a quick little practice of it. And it's really difficult for some women to get there. I literally work with a lot of people who they can get to about here. They cannot picture their pelvic floor. They've had multiple babies. They're great, warm, loving mothers. They can't get down here. Some of that is that natural disconnecting. I shouldn't say it's natural, but they have disconnected because of pain, because of trauma, because of stress, tension, whatever it might be. So that's a beautiful part of your bowl. So also when you're in that space, this is something I say in my office a lot. When you're in that space of quiet, when you have kind of quieted your mind, let the noise of the world fall away. If faith is important to you, this is an absolutely beautiful place to pray from. This is a space to breathe into and to kind of say, huh, either God, I am spazzing out. I've been spazzing out all day. Or I bring you this anxiety, whatever this might be right now. Sometimes if you're really worried about something, you know, stress, anxiety, again, a lot of it is up here in our mind. We're thinking it's this and this and this. And if that happens, then that. Well, if I have this conversation and I say this, they're going to have that. Wives in here, how many times have you had a conversation 10 times with your husband? You walk in the door, you're already a little annoyed with what he's going to say, and he doesn't even know you've had the conversation. You know, we do this. We have conversations in our head. We think of the worst case scenarios. We do all of this up here, and as we're doing it, this clenches. We get that tension in our body. We start breathing up here. We're lacking oxygen. We're getting a headache. It's this chain reaction that happens so often in women. So bring it down here. Okay. Oh, Lord, what are you asking of me in this? I need guidance in this. Or just simply, I bring it to you. I don't know what to do with this. Those are all great practices. And just even having quiet. I encourage all the time, and I encourage you guys to do this too. Take that phone that's always with you, set the timer for 15 minutes, and then put it out of your reach so you're not tempted to grab it. But set the timer so you're not thinking about time. Truly sit in a place you're comfortable, that's quiet. Do that calming and just try to be there. It's a beautiful practice in the busy of our world today to have that quiet, to have that stillness, to be able to rest your mind, to be able to rest your soul. it's a really great practice to get into. So I really encourage you all to try to incorporate that in your day somewhere. So I kind of laugh because this is the point where we talk about all these great things, our beautiful body, how beautifully we're made. Wonderful, right? So what was this whole attack thing? Why is there grief? Why is there trauma? Why is there stress? We all know that there's good and evil. We know that there's always a battle with good and evil. I don't think we always realize how directly we are attacked. And women, with our ability to love, our ability to support, honestly, when you think about the beauty of a woman, the gift of being a woman, just think simply of the pelvis. All the functions it's doing, literally this is a space where when you become a mother, that little soul is formed. This is a place with the marital embrace, with intercourse, that union with your spouse, we believe, is an image of our union with God. There are so many miracles happening right here in this space, the core of your being, of who you are, your strength. Honestly, ladies, the devil is going to come at that with everything he's got. He's just going to. And I don't mean that to be big and scary, but it's something we need to be aware of. It's something our daughters need to be aware of, because it's masked very well. It's masked in culture. It's masked in society. It's masked in social media. But it is so important for our children to know where their foundation is and to know their true authentic self. Because at the age of young people, we know that your ability to logic and reason just isn't there yet. And that's not a slam. I'm not being rude. But honestly, I think it's about age 18 to 20 for females and 25 for males. Literally, the part of your brain that is logic and reason is not developed. So younger women and men, you guys are making choices and decisions based off of the amygdala. This is a big fancy science word, but it's more reactive, where us older adults with wisdom, we're functioning more and making decisions off of our prefrontal cortex. So we have the ability to think of long-term effects, what's going to happen. Younger adults, you honestly don't have as much of a voice of logic and reason. And again, that's not a slam, it's just a true scientific fact. So you take that along with pressures in society and hormones, it's really tough to make good decisions sometimes. So I feel like a lot of what happens is that society, and there's all these messages that we are inundated of, people of all ages, we are inundated constantly with different messages from the news, from society, social media, all of it. And from our families, from our faith groups, we're hearing messages, and some of them are good and some of them are supportive, but there are some messages that our young people are hearing that we would never say to them: how to dress, how to act, what they have to do to be popular, what is their worth, how to measure success. There's a very skewed perception. I'm going to use one example of the feminist movement in America. It's very confusing. I think it's very confusing. So, for example, in Europe, they fought for the right to be mothers and their rights as a woman in that regard. In America, the feminist movement, from the surface, is more about equality, right to work, equal pay, which is good in some ways, because as a human being, yes, we should be equally respected. We should get paid just as well for a job well done. We should have the right to work if we want to. But there's such a focus on, I often say men are naturally geared to hunt, kill, protect, provide. Women are naturally geared to love and nurture. That's not a bad thing, that there's two separate things. And it's frustrating because we're not men, and I don't believe we should try to be men. It's exhausting because it's not how we're genetically geared. I mean, I look at my little kids and the toys that my daughters played with, or even dolls, and my little boy's a very gentle souled little boy, but he picks up a doll and it's like, how does the head move and how does the leg move and how's this toy making noise? They're just geared differently, and that's a good thing. We should be different. So that feminist movement, it's really a difficult thing. And there's actually a wonderful book, if you're interested. It's by Carrie Gress, and I will post that. It's called The Anti-Mary, but it talks about, it really goes into, it's definitely more faith-based, but it goes into the example we have set by Mary, the mother of Jesus, Mary, how we have this example set for her of this quiet, gentle strength. I mean, think about it. She literally raised the Son of God. But that this gentle, deep strength that she has, and it's not this hoorah power, we can do everything you can do, but there's a strength to that, and it's beautiful, and it's not weak. So I think it is. I think it's confusing for women because they're not sure what success is. They're not sure how to be gentle. They're not sure how to be vulnerable because it's told it's weak. And being vulnerable is definitely not weak, but it's standing in your true authentic space of who you are. I feel like there's something other really important in that I'm not saying, but so yeah, so a lot of that feminist movement too is it's my body, it's my right, it's my choice. And that's where I think this attack is big. I think it's truly an attack on the heart of a woman, of our true deep strength to love. So I think there's a pretty big attack on that with the feminism. And again, we should stand for injustices. We should definitely speak up against them, but with our gentleness and our strength also. All right, we're going to move right into sexuality. I think it's bizarre what a contradiction it is to talk about sexuality, because no one wants to talk about it. It's a hard discussion to have. It's with our kids, sometimes even our own spouses. It's a tough one to talk about, and yet we are inundated by it all the time, in marketing, in TV, in music. It's everywhere. So again, it's a very confusing message, I think, for young people, because there's this, everybody is doing it and everybody dresses this way, but really not being sure about even their own body, or feeling this discomfort or almost a shame, or that there's something wrong. You know, I'm not supposed to talk about this, but yet it's everywhere. And it's very bizarre. It's a very confusing message. So this, again, I think is where it's really important to understand your body, to know where your foundation is, to know the beauty of sexuality, that truly it was created to give life. And that's what the actual marital embrace, the act of having intercourse, the focus is to create life, which is amazing. I mean, that's a huge thing. That's not just like, oh, this is fun. It's to create a little soul. And then you look at how society has totally watered that down, and everybody's doing it. I mean, just think of that statement, everybody's doing it. That is it. You just named one of our greatest, most beautiful gifts as a human being, is it. So this is something where, again, ladies, and young ladies especially, the sacredness of your body, the sacredness of your being, that to truly, the person you choose to give that gift to join together with, do they truly honor, love, and respect you? Do they hold you sacred? Do they truly see the gift that you are? You know, is it somebody who's wanting to just take something from you, or something that's seeing the beautiful gift that you're giving them? And honestly, there's so many pressures in today's society to take that very lightly. And I have to say, in my office, there's so much grief and hurt around this. There's a lot of women who have been promiscuous in their younger years. I've never heard one woman say, I'm really glad I did that. Never. And it's beautiful to see some women's journeys where they say, you know what? I made some mistakes, but I've learned from them, and I have a deeper compassion for others through them. And then there's women who just have a lot of hurt there. it's interesting. I was talking with one of the physicians in town, and she said, I don't even get in so much of the morality aspect of it with abstinence, about the importance of it, morality, just because I can explain it pretty strongly from a scientific standpoint. The premarital sex, having multiple partners, the risk of health conditions, the risk of STDs, but also there's a bonding hormone that we release when we have intercourse with somebody. And nature, we were created that way to bond with that person. And there's actually scientific evidence that the more partners you have, the less of that you actually produce. So again, just another thing in your mind of truly holding on to that sacredness and that gift until it's the person you truly feel is worthy of receiving that. Yeah, that's a big one. And again, society is going to tell you a lot of different things. I just talked to a woman the other day. I said, be gentle with yourself. And she goes, I hear you, Liz, but that's so different from any other message we get. I said, it is. You're right. Everything is push, push, push. You can do this. Suck it up. You've got this. And even with sexuality, there are some theories out there of be promiscuous, explore, know what you like, but they're not showing you the other side of that coin, that there's hurt there, there's grief there. You have now given something of yourself to someone who may not appreciate it. Yeah, so society will, and I shouldn't even just say society, I don't know how to say that, but we hear these messages, but then the moment we make a mistake, it's shame on you. You're a horrible person. How could you have done that? So there's kind of there's no forgiveness there. It's come on, you can do this, no big deal. And then boom, it drills you to the ground. So listen to your bodies, ladies, but know you have hormones and not great logic right now. So that's where, take that breath, truly go to the core of your being and take that breath and calm yourself and say, okay, I am beautifully and deeply, wonderfully made. And with the choice I'm about to make, is there any peace in that? Will there be peace in that afterwards? Ladies, you're in a tough world, and you are going to fight this battle over and over and over again. And unfortunately, at times, you're going to be ridiculed for standing in your true, authentic space. You are going to be made fun of for standing up for what you believe in. But again, take that breath and go to that space, and is there peace? But again, know you're human, and we're going to fall short. We all do. Your mothers have, your teachers have, your grandmas have. We've all made mistakes. So don't ever allow a mistake to let shame enter into your heart. Shame and guilt are two different things. Guilt is feeling bad about something you've done. Shame is feeling bad for who you are. We see so much shame in women in this clinic. And it doesn't matter your age, your race, your religion, your status, your demographic. It's universal. But that shame of a mistake you made, that shame of a choice you've made, of whatever it may be. Brene Brown is an amazing author. I don't know if you ladies know of her. I will also put that in the resources. She is a psychologist, I believe, but she does shame and vulnerability are the two things she talks about. And she kind of jokes when she does seminars, no one wants to hear about shame and vulnerability. And she says, well, who here would be willing to live a life without being loved or feeling they belong? Because shame actually blocks your ability to feel worthy of love and belonging. And it's interesting how she explains it, because she calls them shame gremlins, which I don't know if you guys have seen the movie Gremlins, but she says it's like they sit and they fester in the dark and they grow and they multiply, and it brings you down. But if you bring them to the light, it's like they disappear. We think about that own voice in our head beating ourselves down. Oh, I should have done this, I should have done that. If you would say that to your best friend or your mother, they'd say, oh my gosh, it's okay. But in our own head, man, can that get heavy. And that's that other thing too, those negative thoughts, that's not the voice of God. We need to learn to dispel those thoughts, to say, no, that needs to go. Because honestly, that is where that attack will be on your mind of I'm not worthy, I'm not honored, I'm not, I'm not able to receive love, I'm not good enough. So that's that attack on the mind that I think we need to be aware of those negative thoughts. All right. So then we go into social media. So you young kids, like we were talking about this earlier, I don't feel that old, but oh my goodness, how the world has changed. The things you guys have in the palm of your hand, it's unbelievable. And it can be good. It can. There's lots of resources. But you guys are faced with very, very adult things and adult decisions every day at a very, very young age. I have a friend who is a counselor, and she used to deal with some pretty tough situations, domestic abuse, some really deep, heavy, hard things. She then moved into a setting where she was treating more college-age women or working with more college-age women. And she just said, Liz, it's amazing how the trauma these girls have, she was used to this really deep, ugly, hard trauma. She said they have just as much trauma from being ghosted on social media, from their Snap story, I'm not going to say it right, not being followed. And we really talked about that, how really in the world a lot of you are growing up in, that is your human connection in a lot of ways. And there's such a trauma and that literally fear, anxiousness of the bears chasing you because someone didn't like a picture or someone didn't follow something or someone didn't respond quick enough. I don't know what the fix is for that, but be aware of how much that's affecting you. Trying to even maybe just have scheduled time away from your phone to not think about that. And when you notice, but what somebody say, did somebody text, did somebody recognize that need to belong and to feel loved that is coming from people that you maybe barely know, their acquaintances. But we put a lot of value into that, and that's kind of the world you're growing up in. So again, that attack on the mind of, we can be grateful and know the blessings we have and take one look at social media and see someone who's got so much more and feel like we have nothing, or we're not worthy, or we're lacking for something. So be aware of that in the social media world, in the electronic world, I guess you could say, that's one way that can really cause a lot of heaviness. It can cause, we're seeing huge increases in depression and anxiety in our young people. And so much of it is depending on the likes, the notifications, the ding of the phone. So being aware of that heaviness, and also don't ever be afraid to talk to someone about that again, our own worries, our fears, our hurts, that you're not alone in feeling that. A lot of people do, but talk to your parents, talk to your teachers, talk to a counselor, because depression and anxiety is a very real thing. And it's masked in such a way today that it's easy to hide it. And sometimes I think young women don't even realize they have anxiety. It's just kind of their normal. So again, having that tool, that bowl to go to, that space to have that quiet, to recognize, am I really agitated right now? Am I sad? There's times you're just, I'm annoyed. What is it? Are you angry? Are you sad? Are you scared of something? Are you worried? It's really good to be able to name what that is, even if you're not sure why you're feeling it. Okay, so go back to that bowl. So I want you guys, again, close your eyes, relax your hips, your thighs, your butt cheeks. Think about breathing into those muscles. As you inhale, think about the oxygen, the blood flow going to that space so those muscles can actually relax. As you exhale, let any tension out of your body. Literally think of wiggling your toes, relaxing the muscles of your face, your neck, your shoulders. And as you sit in that quiet space, I just want to encourage you that there's going to be storms in life. No matter how well we prepare, no matter how right of a choice we try to make, we're going to misstep, and that's okay. And there are times, no matter what we've done, there are going to be storms that come. But to truly be able to come to this space you're in right now, to take those breaths, to calm the fear, calm the anxiety, to truly sink into your foundation. What are you anchoring into? And to trust and to know how beautifully and intricately you are created. Because God does not make mistakes. You are exactly who you are supposed to be. To know you have these tools built into your body that are going to be able to help you weather a lot of storms. And your body's not going to lie to you. It's going to give you cues. It's going to give you that little whisper when something's off. It's going to scream at you when you start to ignore it. So learn to trust that depth of your being. Learn to trust when something doesn't feel right. Learn to acknowledge that. And remember, always, always remember how deeply you are loved by many. All right, so I'm going to end with a quote from St. Catherine of Siena. We will stay tuned for questions. So the quote, the actual quote is, "I still say that I trust in our Lord Jesus Christ because I see that there is no comparison between my sins and divine mercy. Even if all the sins that could possibly be committed were gathered together in one person, it would be like a drop of vinegar in the sea." So to paraphrase, no matter what you've done, no matter how embarrassed you are, mortified, whatever it might be, no matter the wrongs you have chosen, if you put them all in one moment, it's but a drop in the entire ocean of God's mercy. I think that's such a beautiful visual because honestly, we can really, really be hard on ourselves. We can really beat ourselves down. We can very quickly have that shame and not feel worthy. But I think that's such a beautiful visual, literally a drop in the ocean of mercy. So when you're having those days, when you're having those rough times, think about that little drop and know how vast that love is that is just waiting to engulf you because it's beautiful. And so he doesn't make mistakes. It truly is a gift to be a woman. So take that seriously and truly honor that and be proud of that. Yeah, that's the end of the talk. I always say I'm terrible at closings. I'm terrible at goodbyes. So we always get to it. I'm like, that's it. So I know it's not always super comfortable to ask questions in person, but any questions that things you'd like me to clarify, anything like that, or Natalie, if there's any online questions, I'm not sure. Okay. Okay. So what I would appreciate from you guys is if you want to email us, or if you want to just make notes and leave them, that's fine too. Anything you'd like clarity on, anything you would like to be gone deeper into. We are going to also be doing some other talks. I mean, we could do a whole talk on just sexuality and the pelvic floor and pelvic pain. There's just a lot of areas that we see so, again, much disconnection for women in their body, and they're truly just not even able to embrace a lot of the gifts that are there. So we will be doing more talks. We're going to do some that are going to be more conversational, just the therapist sitting talking. So they won't all be with an audience. So if there's even topics that you're like, I'd like to hear more about that, or be interested in something about this, and we are talking about even bringing in some guest speakers sometimes for those conversational ones that we would then post. So please let us know if you have any thoughts on those, anything you'd like to hear more about, and then also if you're interested in getting notified on that. I'm sure there's some way we'd notify you. I don't know what it is. Joe will take care of that. So thank you, and thank you to the virtual also who joined us. Yeah, thank you for being here. It's an honor having all of you.